गुड आफ्टरनून एवरीवन। आज जो मैं टॉपिक मैं आपको बता रही हूँ, दिस इज ऑल अबाउट योर इनकम्पैटिबल रेमेडीज और द इनिमिकल रेमेडीज। What are the incompatible remedies that do not follow each other well? Okay, for example, phosphorus and causticum, lachesis, ammon carb, rustox, Apis mellifica. So these are some inimical remedies. If you go into the Mathematica, you will see that compatible remedies बहुत सारे हैं, but incompatible or the inimical remedies are less than 100. मिलेगा कहाँ पर मुझे इनकम्पैटिबल और इनिमिकल रेमेडीज? मैं डिस्क्रिप्शन बॉक्स में एक लिंक दे दूंगी, और यू विल ऑल्सो गेट फ्रॉम द एलेंस की नोट, जो मैथमेटिका हम लोग पढ़ते हैं, एलेंस की नोट, एंड ऑल्सो फ्रॉम द बोर्डिक्स मैथमेटिका, वहां पर भी आपको मिल जाएगा लास्ट चैप्टर में रिलेशनशिप ऑफ दिस रेमेडीज में। ठीक है, अगर सपोज आपने किसी पेशेंट को कॉस्टिकम दिया और तुरंत ही बाद उसको फॉस्फोरस दे दिया, तुरंत बाद मैं बोल रही हूँ विद इन 2 to 3 days, then either this incompatible remedies increases the existing complaint, और या तो कुछ वो नए complaints ला देंगे which is unrelated to the case, or it was never occurred in the patient earlier by the patient. Okay, never experienced earlier by the patient. So these are the action of the incompatible remedy. So you should always see, whenever you prescribe any remedies, always see that what are the follows well remedies and what are the incompatible remedies. For example, जैसे कि कोफिया मोस्ट ऑफ द केसेस क्या कहता है, ड्रग इंक्रीजेस दी, बेसिकली द कोफिया जो मेडिसिन है, दिस इज एन इनिमिकल टू दैट ऑफ कैमोमिला, इनिमिकल टू दैट ऑफ colchicum and the cantharis. Now suppose if the patient is taking cantharis, either he is in cantharis proving or he is taking cantharis for other complaint, and if he is in coffee akoda for some other complaint agar usko diya gaya ho, then it will increases the excitement and the frenzy produced by the cantharis. ठीक है, now there is one of the case, for example, there is one of the case where the patient was given veratrum album for the purging and the diarrhea. ठीक है, उसको veratrum album दिया गया, and the diarrhea was cured, but the patient was suffering from now the debility. For that, China was given. As soon as the China was given, जैसे उसको China दिया गया, within 30 minutes के बाद again the purging started. After again, then veratrum album was given. ठीक है, and when the purging stopped, now for the debility, acid was given. ठीक है, so what you see that veratrum album is antidote or it is inimical to that of the China. जो veratrum album डायरिया या पर्जिंग को डिक्रीज कर दिया था, कम कर दिया था, जैसे ही आपने चाइना दिया, दैट हीलिंग प्रोसेस गेट ऑब्स्ट्रक्टेड। ठीक है, सो दीज आर द एक्शन ऑफ द इनकम्पैटिबल रेमेडीज है। सो डॉक्टर केंट ने भी कुछ डाइटरी रेस्ट्रिक्शन भी बताए हैं कि वेन एवर यू गिव दिस मेडिसिन, टेल द पेशेंट नॉट टू टेक दिस टाइप ऑफ द फूड। फॉर एग्जाम्पल, इफ अगर आप किसी भी पेशेंट को कॉस्टिकम प्रेस्क्राइब करते हो, इफ यू आर प्रेस्क्राइब कॉस्टिकम टू एनी ऑफ द पेशेंट, यू नो दैट कॉस्टिकम कैन नॉट टॉलरेट कॉफी। ठीक है, तो कॉफी उनको लेने के लिए मत बोलना। Similarly, if the patient is on Naxwamika and the China, he or she should avoid tea and coffee. If the patient is on Thuja, he or she should avoid oysters. If the patient is on antin crude, he or she should avoid the sour and the savory things. Okay, and if the patient is on nitric acid, sepia, calcarea carb, he or she should avoid milk and the milk product. And if the patient is on argentinum nitricum, she should avoid your candy or the sweet things. So these are some dietary restriction which was given by the doctor Kent. ठीक है, so dietary restriction is also one of the inimical remedies because आपने दवाई दिया, पेशेंट ठीक हो रहा था, अचानक से पेशेंट ने आपको फिर बोला कि मैं तो सब कुछ ठीक ठाक ही खा रहा था, फिर मुझे क्यों कंप्लेन वापस आ गया, क्या मेरा प्रॉब्लम ठीक नहीं हुआ? देन यू हैव टू सर्च फॉर दैट कि आपने क्या लिया था, if you suppose if you're giving a patient thuja and उसने कुछ oysters वगैरह लिया, उसे complaint फिर से वापस आ गए, then you have to tell them कि you have to stop the oysters. ठीक है? Now, there are some example of the other inimical remedies, for example, lachesis and the ammon carb, lachesis and the CPR. Lachesis and ammon carb दोनों ही hemorrhagic diathesis हैं, ठीक है, दोनों में ही like sleep aggravation है, ठीक है, दोनों में ही choking sensation है, but दोनों and whenever you give lachesis, it should never be followed by the ammon carb. It can be followed अगर आपने lachesis दिया 1-2 महीने तक वेट किया, then you can give the ammon carb, but not immediately. ठीक है, जब मेडिसिन की एक्शन एग्जॉस्ट हो जाती है, then you can give this inimical remedies. Similarly, in the case of the lachesis and the CPR also. So there is one of the case. It is basically an observation of the doctor clerk. He found that a person is suffering from the menopausal symptoms, and for that lachesis was given. After lachesis, the patient was already very well, but there will be an intense tenesmus. Okay, there is a distressing rectal tenesmus for which CPR was given to antidote the action of this lachesis. ठीक है, lachesis high दिया गया, the patient was well, but he gives some symptoms, and that is a rectal tenesmus, and it was not going. Okay, so to antidote that medicine, CPR was given. ठीक है, so it was said that कि अगर आपका potency and the medicine is similar होगा, there will be no aggravation of the sign, means of the condition. ठीक है, अगर आपका medicine similar हो, okay, if this medicine is similar, if the potency is not similar, it's okay, but if your medicine is similar, it is going to act, either there is an aggravation or there is an amelioration of the symptoms. If there is no changes, that means medicine doesn't work, मतलब उसने कुछ काम ही नहीं किया. ठीक है, so कभी भी अगर medicine देखो कि you have to see whether कुछ मेडिसिन कुछ कंप्लेन आपकी बढ़ गई है या कंप्लेन कम हो गई है. अगर कंप्लेन बढ़ भी जाती है, दैट मीन्स ऑल्सो योर मेडिसिन इज सिमिलर. ठीक है, एंड आइदर यू हैव टू एंटीडोट द एक्शन ऑफ दिस एग्रेवेशन, यू हैव टू एंटीडोट दिस इफ इट इज too much troublesome for the patient, or else wait and watch, the patient will get cured. Basically, we also want कि aggravation ना हो, but if there is an aggravation which is also a positive sign. ठीक है, हमें पता है कि if you are giving medicine in a centesimal potency 30 to 100, okay, 1m 10m, there is an aggravation from in the beginning of the treatment. ठीक है, but if you are giving this medicine in the LM potency, that is 0/1 and 0/2, there is an aggravation at the end of the treatment. ठीक है, so ये दोनों बात याद रखना. And yes, and whenever you give any remedies, its action should be noted. There is an either कुछ action होगा या तो कम या तो increase of the symptoms, and if there is nothing happen, that your medicine is not right. That is the thing. ठीक है, so this is all about your incompatible. I will in the description box, I will put the link where you will get the remedies which are incompatible and which are inimical. ठीक है, so thank you everyone.